Okay, so selamat pagi, selamat siang, selamat sore, selamat malam, wherever you are. Welcome to our June Monash Indonesia seminar. And to start, I want to acknowledge the traditional custodians of the Kulin lands upon which some of us are placed today, including me. I want to pay my respects to the elders of this land, past, present and emerging, and acknowledge that claims to sovereignty were never ceded. My name is Sharon Graham Davies and I'm the Director of the Herb Feith Indonesian Engagement Centre here at Monash. So I'd like to welcome you all today from across the world, and particularly any guests who are here now from Indonesia or who will listen later. We're recording this event and we'll put it on our Herb Feith website shortly. And as we go through the seminar, do type in questions into the chat box and we'll come to these at the end of the talk. And also a little plug, do follow us on Twitter and our Herb Feith Facebook page, and you can keep up to date with all of our activities. Now, just before we introduce our speaker for today, I want to turn over to Reni, who's going to tell us about the resources that we have here at the Monash Library. Thanks, Reni.
Thank you, Sharon. Welcome, everybody. So glad to see some familiar faces, but some new faces as well. So I'm glad that today you can join us at this Monash Indonesian Seminar Series. We're already in June, so I can't believe it. But unfortunately, Melbourne is back in lockdown again. So this is the 4th time. So we are working from home again until the next 7 days. Luckily, we do have online resources that we can access from home. So I'm going to share some of those resources with you. So to access all our resources on Indonesia, whether it's in Indonesian language or in English, you just have to access it through Monash Library catalog. So for example, today's topic is about birth certificate and children's rights. So I put keywords such as this, children's rights in Indonesia. So you will retrieve some English language resources as well as Indonesian language resources such as this one, for example, perlindungan hukum terhadap anak dalam hukum keluarga. So there's other resources as well. So as you can see, as I scroll down, hukum perlindungan anak, and heaps of other books that we have at Monash Library. The second database that I would like to share with you today is something that is a quite remarkable resource, or a quite remarkable database. It's called Hati Trust Digital Library. So I'm just going to go back here. So it is a digital preservation repository which holds the largest set of digitized books managed by the academic research and library community. So you can access the digitized collection, including various resources on Indonesia or even Asia, if your university is part of a Hati Trust membership. So check with your librarian. So Monash is certainly one of them Hati Trust members, but basically there's heaps of very rare and archival materials that they have digitized. So for example, I just put some keywords, Indonesia and politics, and there's quite a wide range of resources you can find. But for example, the first one is a 1973 book. And you can actually see the full text of the book online through this Hati Trust Digital Library. There's heaps of other resources. I tried Indonesia and VOC, for example, or even there's a lot of historical materials that have been digitized. So I strongly encourage you to look at the database. So I think that's it from me, Sharon. I'm going to give it back to you.
Lovely, thanks Reni. So today I'm so pleased we're joined by Dr. Santi Kusumaningrum. Santi trained at the University of Indonesia before receiving her PhD in public health from Columbia University in New York. And Santi has one of the best bios when I was, stalking her to find out more about her on her website. And she notes that she takes crafting an argument as her primary sport, in addition to doing the regular exercises. Santi is director of Puskapa, which is the Centre on Child Protection and Wellbeing, and that's based at the University of Indonesia. And Puskapa does a lot of amazing work. It brings together an interdisciplinary team of researchers and policy thinkers and program implementers, and they strive to achieve social justice in key areas like social inclusion and protection, legal identity, which we'll hear about today, and access to justice. And Santi will be joined today by her colleague a little later on, Shaila Tikan, who has wonderful news that she's following in Santi's footsteps and will head off to the US as well, off to Colombia. So as we go through the talk, please do type your questions into the chat box. So I'm sure there'll be many that arise. So without further ado, I would love to turn over to you, Santi. Santi, thank you so much.
Thank you, Sharon, for such a wonderful introduction, as always. And I think, first of all, I'd like to say hi to everyone who's here in the room. And this is such a lovely, so this is not a webinar room where we are separated from the participants. This is actually more like a conversation among friends. I think that I'm sure it will make our discussion in the next hour more effective as well. And so I will begin my talk of the day, and this is to talk about legal identity and the whole civil registration and vital statistic system in Indonesia. I'd like to begin my talk by sharing you a story. It just happened this morning. So some of my friends, actually 2 friends, texted me and asked, I think they saw the poster somewhere about the seminar or webinar, and then they asked, like, is it still a problem getting a birth certificate for most Indonesians? To which I replied, things are getting better. We have to acknowledge that the government is trying and putting a lot of good efforts, but we also have to remember that that it is still quite difficult for the most vulnerable to access birth certificate. And also, I know this is probably hard for some of us to talk about or imagine that a piece of paper can mean a lot in someone's life, more than that, a piece of paper. But the evidence actually tells us that it does mean a lot to someone's life. And I think it's probably easier if we reflect together based on the situation we're all in right now. And Rennie just told us all that you are back in lockdown in Melbourne and I think Victoria areas. Well, for me personally, I've been in lockdown since a year. I told Sharon the other day that it's over a year and I've been to the ATM like 3 times. And the reason why I chose to do that, because I still want to be able to visit my mom, who is 72, and lives in the red, almost black zones in Depok. And I don't want to expose myself to a lot of risk that I can bring to her when I visit her. But I think the question is, are we all in the same boat? I think no, because this pandemic actually teaches us that for some people, it's doable to make such choices like the one that I made. But it's not possible for many other people who have less resources to mitigate the implications of this pandemic. And I think one of the most apparent lessons that we can at least gain from this over a year pandemic is that we observe that governments can respond better if they have a complete picture about their population. And that is exactly where we need to situate our discussion about birth certificate and birth registration. So in the early months of the pandemic, we in Puskapa worked together with Bappenas, the Ministry of Planning in the government of Indonesia, to develop a set of policy recommendations about how responses around this pandemic should consider those who are probably most at risk, but probably out of the radar, out of the statistic radar of the government or the usual programmatic databases. And one of the key groups that we identified together with Bapenas are children, the elderly, and persons with disability without a legal identity. And just to give you some perspective, we know that there were still over 1 million elderly people and over 400,000 people with disability who did not have a unique identification number or NIK in Indonesian. And when President Joko Widodo announced the 8 focused provinces about the pandemic responses, the 61% out of those elderly who did not have an NIK resided in those 8 focused provinces. Also 57% of people with disability who did not have an NIK. So I think the argument that I'd like to make here, and now I hope everyone can see the reasons behind it, is we believe that because most of government programs and responses are planned and designed and delivered using government's registry, and most of them require an identity document before a citizen can access them, we believe that a chance of survival really depends on, one, visibility to the system, hence being registered or not registered. And this also affect among the youngest population in the country. And as you can see, still almost 6 million Indonesian under 5s were without a birth certificate. And birth certificate and NIK, ideally in Indonesia, they're produced at the same time. So as soon as someone is born, the government assigns them an NIK, the number, and also produce a birth certificate for them. So without one, it is, I think you can assume that if someone doesn't have either, it would actually mean that they are not on any databases that the government actually managing. And although I'm sure maybe some of you have heard that in Indonesia, you also get a national ID card, now an electronic national ID card when you turn 17. But again, we argue that registration has to start at birth because because at birth records really signifies someone's existence from the very beginning throughout their life cycle. And also, we believe that some of the markers around birth registration are actually symptoms of the bigger problem of the whole civil registration system in the country. And up until 2013, we are still one of the countries with the largest numbers of under 5s being unregistered or without a birth certificate. And this is really, I think, troublesome because without a functioning birth registration system, the jargon of evidence-based development will always leave some people behind. For example, even if you get an ID card by the time you turn 17, it means the government is missing the first 16 years of your life, and you're not recorded on any of the databases. And later, if you look at the data, we also learned that parents register their kids to get a birth certificate when they apply to school at 5 or 6 years old. So it means there's also a data gap and delay in terms of the government understanding their population completely. And this is very important because a civil registration system, when it functions, it can do actually 2 things. So one, it gives people the rightful legal identity documents by which they can access public services and secure citizenship. But at the same time, actually, when you're registered on the system, your data will be a part of what's considered by the government in designing their programs and delivering their services. So it really, there's 2-pronged sort of functions of the CRVS system that makes a birth certificate more than just a piece of paper. So now let's look at the situation. Indonesian government targeted as 85% of all children having a birth certificate by 2019. And if you look at the data, this is what we analyzed from the socioeconomic National Socioeconomic Survey, or Susenas, from 2011 till 2019. And you can see, oh, there's actually a promising, trend upward when it comes to birth registration among under 18 in Indonesia. And the 85% target was achieved. So congratulations, Indonesia. But then we observe that when you go below, so when you look at or when you observe under 5 and under 1s, the trend is not that, I think, not that promising. And this is a problem because then there's something still quite wrong with our at-birth registration system. And we also try and impose this sort of historical markers or milestone where Indonesia removed the mandatory court hearing for late birth registration. Ministry of Home Affairs also issued a regulation that acknowledged statutory declaration for parents whose marriage were unregistered, so they can then have a birth certificate for their children under both the father and the mother's name. And also there's a whole revision with the population administration law. But as you can see, it doesn't really do anything. It didn't really do anything to at-birth registration. And there's another, I think, problem that we need to also be mindful about is that lack of birth certificate is still an issue among the poorest in the country. More so, it's still a problem of access because lesser children in rural areas have a birth certificate compared to those and their peers in urban areas in Indonesia. But then why? So we also looked at Susenas and try and understand the reason why people did not have a birth certificate. Unfortunately, this question was removed after 2016, so we could not have the latest data. But from the last one, the 2016, we can still see that it's not because people don't want to, it's not because people are lazy or not aware, but it's because they cannot afford it, and other structural barriers reported in Bappenas as reasons for not having a birth certificate. And of course, we in Puskapa are also fortunate to be able to secure multi-year support in doing research and really implementing program actions around these issues. And both are from Australian government's collaboration with the government of Indonesia. So the ongoing one is with COMPAC, a Australia-Indonesia Partnership for Governance, and the previous one is with AIPJ, Australia-Indonesia Partnership for Justice, who was led by Kate Sumner, and she's also participating in this discussion today. And I'm sure this is all nothing new to her, but I'm sure she can also add to the discussion later. But we also find it very important to have a deeper understanding about what's going on. And we did 3 actually studies so far. In 2013, published in 2014, in 2015, published in 2016, and recently in 2019. And we're waiting for the government of Indonesia to launch the study in late June. So this month, there will be a new study. And the findings from our select surveys actually confirm what we learned from Susanna. So cost, distance, the fact that the process is very complex, and the time required to apply for a document really prevent people from having one. And more so, we also see that even though we are talking about birth certificate, for example, when we are talking about birth registration, each of the vital events registration are really interlinked to one another. So like, for example, the study that we did with Kate Sumner back in 2013 showed that 70% of the children of the 50% of married couple without a marriage certificate also did not have a birth certificate. And we still see that even though there's this statutory declaration, so some relaxation of the requirements, not having a marriage certificate among parents still prevent them from getting a birth certificate for their children. And we also see some other forms of vulnerability around this issue of civil registration, like, for example, among parents with disability, and also still, even though the government claimed that it is universal, the ownership of ID card or KTP or KTP is still quite problematic in some of our select survey areas. And also, I think you can see that one of the most worrying ones is that 22 children we met during the survey were not listed on the family card of their household. And that is alarming, because without having registered on a family card, it means they are not included in the JKN, in the social insurance scheme, because the registration is based on a family card, for example. And then using the 2015 data, we tried to do more and more secondary analysis to look at what actually can be associated with birth certificate ownership. And you can see that parents having legal documents, starting from family card to national ID card to marriage certificate, are significantly associated with the child's birth certificate. And also the child's age. As you grow older, the chance of having a birth certificate increased, the child's schooling status, and the child's immunization status, and also the parents' participation in community meetings. But if you also observe only under 5, these 3 reasons or 3 variables are the ones that are really associated significantly with a child having a birth certificate or not. And because this is a simple regression, we can also assume, although probably not statistically conclusive, that having a birth certificate can also affect your chance of getting to school. And it can also signify whether you have access or not to health clinics or health points where vaccination usually happens, so things like that. And the reasons are still the same if you even do only a subsample of those who failed to register their child's birth. The reasons are still structural. But the good news is we found some hopeful pathways that can ease birth registration. So having a village officers helping families with birth registration was found as significantly positive to a chance of a child having a birth certificate. And also, of course, the completeness of documents owned by the parents. But again, if you observe them together, the structural barriers are still more prominent compared to the technical barriers in the application process. Unfortunately, what the government has been doing a lot, the government has been doing a lot of things, a lot of breakthrough policies. They mostly address the technical side of the system instead of the structural barriers that we just discussed. This is one example. So one of the breakthrough policies is the 3-in-1 policy. So when someone is born, then the system would assign that person an NIK, the number, and then immediately produce a birth certificate, update the family card, and also the child will receive a mini size of the birth certificate called KIA, or a child ID card. Okay, this is what the technical side would look like. Unfortunately, this is what citizens experience when they don't have one of the requirements. So I know this is probably difficult to see. I'm sorry about that, but this slides can be distributed later to all the participants. But we are trying to break down the technical process into what does it really mean for people who are not having a straightforward sort of life. So they will be facing a lot of complications, and unless the policies address those complications, some people and the most marginalized would always be most affected by this. And it's even more complex when it comes to hidden populations. So later in the discussion, Shayla will add about her experience working with asylum seekers in transit and refugees population around these issues as well. So I think to end my talk, so we can have a more discussion, we really need the government to acknowledge and then resolve the structural complexity faced by citizens. We have 6 policy propositions, and each is addressing the structural barrier side, the technical barrier side, the individual capacity side, and the discriminatory policy or system that exclude people from accessing it. And then we can have them in a more detailed during the discussion. Thank you, Sharon.
Thank you so much, Santi. I mean, it's just extraordinary that last graph in particular, that if everything works for you, then it's not that bad, but you're missing one part. The journey is just incredibly complicated. And if you have other factors, like you have to work and you've got other kids to care for, it's just, you know, impossible. And without that, you're excluded from access to so many things. So I'm sure there's lots and lots of questions. We're happy to take questions if people want to ask them verbally or to type in those questions. I haven't even checked the chat yet, if we have any here. Not quite yet, but I'm sure people are thinking of them. So just speak out if you wanted to. If you didn't want to type one in, we're happy to.
Yes, or even if Shayla wants to jump in and add on the refugee side, Shayla, go ahead.
Okay, while we are waiting, I guess I'll add a little about what refugee communities are facing in Indonesia. I'm sorry I'm not turning on my camera. The connection is not that good. So in refugee or asylum seeker situation, it's not only about accessing basic services, but also for uniting families and protections in time of migration. So I think, as Mbak Santi said earlier, the refugees communities are outside of the conversations. And of course, they're outside of COVID-19 responses in Indonesia. It's quite hard without the aid of international organizations for them facing COVID-19. And even though we are sure that Indonesia is committed to protect every child in our country, and registering at birth is basic rights for children, but the situation is very different for non-citizens, especially those without protection from their countries of origin, like asylum seekers. When we know that living in transit doesn't mean life is in transit, actually, we are still living and getting married and giving birth in Indonesia. So it's quite a problem when the frontliners also have the same mindset that giving out BC is also giving out citizenship, which is not the case. So yeah, I think it's also as complicated when one of the parents is Indonesian. It's not as easy as we think it is, because Indonesia only register children whose mothers are Indonesian. Without marriage certificate. So yeah, I think that's roughly what our refugees in Indonesia are facing right now.
Yeah, I mean, it just adds a whole nother level of complexity if both you know, the mother and the father aren't Indonesian. I can see some questions coming in. That's great. Anita, do you wanna read out the first one?
Well, we've got two questions, but we also have Kate, isn't it? Having your raised hand. Do you wanna say your questions, Kate?
Yeah. Thank you so much, and thank you, Santi, for such a lovely presentation. The work of Puskapa is so extraordinary in terms of what a strong organization it is and continues to be for Indonesia. So thank you so much for that update.
Thank you.
As a Monash alumni, I'm so happy to see you presenting in this forum as well. But I wanted to really, I suppose, throw a comment or just a perspective from the work that's continuing in the Australia-Indonesia Partnership for Justice. And it has such an important role in terms of the work that Puskapa does. And it's really looking at the changes that we can see in Indonesia following the revision of the marriage law in 2019. And it goes to the heart of what you're saying and what we've known for so long, which is that if you don't have a marriage certificate, that's really one of the drivers of it becoming so difficult to get birth registration. And as you said, marriage certificates, it's the same range of issues: cost, distance, complexity. You know, do people think it's important to get a marriage certificate, or do they just want to have the party? So it's how do you deal with this? And I think where the revision to the marriage law comes in is it raised the age, obviously, at which parents can provide permission to marry their daughters to that at which they can marry their sons at 19 years of age, and under that requires them to go to the courts. We've seen this cycle before of anything that goes to the courts becomes a very complex, difficult issue for everyone. And so I think what we're seeing is this cohort emerging of hundreds of thousands of girls and boys who we know from Susanas 2020 and the data are marrying under the age of 19. And yet we have a fraction of those cases coming to the courts for the dispensasi kawin or the dispensation to marry. And so what we are seeing is this really tragic cycle of marriage of young girls and boys without a formal marriage document, and then having those children having children themselves who are unable to get married, who are unable to get birth certificates, and the cycle just rolling on. But I think it's important to recognize the work of your organization and Bapanas and many other organizations in the national strategy on ending child marriage. But that really is an area that we can see where we're just getting probably, we estimated at around 15% of boys and girls under the age of 19 who are marrying, coming to the courts to get that dispensation. And so therefore 85% of hundreds of thousands of boys and girls will not have the dispensation, and therefore the cycle goes on. So I know that you're working in this area, but I thought I'd mention it because it's the intersection of sort of sort of disadvantage that keeps cycling on. Anyway, thank you, Santi, and thank you.
Thank you, Kate. And because you know me so well, of course, the caveat of having a sanctioned, sort of like quote unquote criminalizing marriage under 19 and having them, you know, like obligating them to go through court to be able to be registered. We put it on the table in every discussion about ending child marriage responses and strategies, and that makes us even less and less popular among child rights activists. But that is the reality. And it's not that we then becoming a pro-child marriage people, but it's really about like considering all aspects and all risks and consequences by putting in place a certain law or a certain like regulation and whatnot. And I think what we are trying to do, at least now, is continue to monitor the data and see if something really, really, alarming, that we need to be able to respond quickly. That one. And the other is to never stop. I think this is probably outside of the discussion, Kate, but this, I think, has become a problem within development as well, because everyone is now pursuing policy changes and sort of leaving behind the social norms changes. And I think the work still needs to continue on both sides. So we cannot have a policy change without us continuing to work and make sure that the harmful norms are basically being mitigated at community level, especially the ones affecting children. So I think that would be a non-response from me, but I agree with you that this is some of the unintended probably consequences of putting in place a good, well-intentioned policy. Yes. Mm-hmm.
Great, and I can see some excellent questions coming in. Anita, do you want to kick us off with the first question?
Yes, from Pak Greg. Mbak Santi, with regard to citizenship entitlement, does Indonesia mainly adhere to EU solis or EU sanguinis, or a combination of them? How does this affect the process of obtaining documents necessary for the various identity cards? Interesting question.
Thank you. And can I call on Shayla to actually take this one, because it's more her area of expertise?
Okay, Indonesia is a sanguinis country, so we register children based on their bloodline, how they are relating to parents. But of course, we are not, our citizenship policy is not really in line with this, because we only, we did not acknowledge statelessness, so we don't have any statelessness determination procedure. So when someone is stateless, we as a country is obliged to give them citizenship, right? But Indonesia's citizenship law only acknowledge foundlings, which are children who are found without their parents. They are not the case in stateless communities. Consequently, I don't think there are any viable pathways for stateless population to reach documentation in Indonesia. And I think we also acknowledge this, Mbak Santi, in our kerentanan study, that one of the possible complexity is those who are living in the border communities who cannot really prove whether or not they are Indonesian.
Pak Acho, did you have a follow-up question?
Thank you. That clarifies quite a bit. I guess for example, relating to people in Papua on the border with PNG, for example, there were people who fled into PNG and then came back and then have not been able to get any sort of papers or such because they are not recognized as Indonesian citizens, even though they may have been born in Indonesian territory, but in the crucial years they had fled to PNG. So how can such people, do they have any recourse at all to trying to get some of the documents that you have mentioned in this really engaging presentation?
Yes. Unfortunately, I cannot really offer you some more optimistic answer, but so we have not yet any experience in facilitating or assisting in border communities, but we do have some quite a bit experience in helping Papuans getting their legal identity documents, and this is in relation with a social assistance program being rolled out in Papua, and the fact that the program requires people to have an identity document so they can access the social assistance. What happened was that a lot of advocacy effort and negotiations with both the local government and the central government, and really convincing them to have a discretionary policy for that one program only, and use the lessons learned to really advocate for a sort of broader and more institutionalized policy onward. Yeah. Sheila, do you have anything on in-border community for Pak Greg?
I think I've read just a refugee surveys on that particular issue, Pak Greg, and I'm not sure if there is no organization that is advocating actively on citizenship and helping this community proving their citizenship. I don't think there are other active effort from Indonesian government to acknowledge their citizenship. So I think that's one of the issue we are facing right now.
Great, thank you all. Our next question is from Chloe, and she's asking, do schools, health facilities, police, jobs accommodate in any way for the population without the certificate? And how do people get by without it? How do you get medical care in the first 5 years without, the documents?
Well, the one thing, at least from data, what we can understand is that Indonesia has this social insurance program. So it's health insurance for everyone, especially for the poor, it's subsidized by the government. But the program itself requires a family card for all the members of the household to be able to get a benefit from the insurance. So I think that quite telling about when you're not registered on a family card, which can be sort of signaled by you're not having a birth certificate, then it means you're without a health insurance. So that one. But can they access medical care? This is not a straightforward answer, because a lot of initiatives in the health sector, for example, Posyandu, so it's a community health posts helping basic immunization and the basic health checkup for new mothers and newborns are there without asking for an identity document. So what one of our advocacies is actually collaborating with this frontline points, including health and education, to identify the demand of those people without a legal identity document, and not to shun them away from receiving services, but making them register, informing the Home Affairs Authority that there are people who need identity documents, and they can then go and meet them and provide them with the registration process. So that's, yeah.
Great, thank you. Anita, do you want to take the next one?
Yeah, next is from Bulin Parker, who's also thanking you, Mbak Santi, for your great presentation. So the question is for people who don't have a marriage certificate, for example, nikah siri. Do you have any suggestions for how they can get their children registered or get birth certificate for them?
Thank you, Bulin. So according to the regulation, they can actually get a birth certificate under two conditions. So one is when they are willing to get the birth certificate under the mother's name only, yeah, or if they have a family card and on the family card they are recorded as married, then they can have a statutory declaration saying that we are the parents, and then the child can get a birth certificate under both the father's and the mother's name. And then later on, in theory, by regulation, the parents would then have a marriage certificate. The third option would be for the married couple to go to court and get their past marriage legalized. And then based on court decision, then they can then register their marriage to the Religious Affairs Office. So it's very complicated. I think most of this answer would be like, it's possible, but then is it easy? Then that's a different question. Thank you, Bulin.
Lovely, thank you. And our next one is from Mas Ben. So I'll read that out.
Hi, Ben.
Him. I know, he said the other day he was looking forward to seeing you. He's there somewhere. I'll read it for you.
Hi,
Ben.
thank you very much.
Good to
Unless,
see
do you
you.
want to read it now that you've unmuted? No, I'll go. So Ben's interested in how much this problem might stem from the definition of warga or citizen as tied to a fixed address or a residential location, and then bureaucracy imagined from the erte, erwe, up. So Ben knows, for example, among homeless populations and many others who migrate widely, there are real challenges with accessing citizenship papers of various kinds. Thanks for an awesome talk.
Very true, Ben. And I think we need to have a conversation after this, because it's an area where I think we need more like historian sort of investigation, because I suspect it has everything to do with how even family card concept was, you know, given a birth to during Suharto era, for example. But to answer to your question, it is still quite problematic because I don't know if you are following the news from Indonesia, but only last week, there's this small win, a small victory among transgender community that now Home Affairs or Dukcapil acknowledge that transgender communities are still lacking ID cards. So they are now acknowledging their existence and willing to help more with their process, like, to ease the process of them getting an ID card. But I think one of the problems that remain is that the domicile requirement then, and it really, first, if you don't have an address, a fixed address, you cannot get any documentation. But also the definition of address means that you have to be registered on someone's KK or family card. So if you're, for example, if you have a home and it's a rent, and it's a rental, you cannot register yourself under that address because it's not yours. So it means you have to advocate the homeowners to put you on their family card, so then you can get an ID card in reference to that address. And really linking our identity documents and updating it based on our address, it's very important because lots of services in Indonesia is sort of capped within certain jurisdiction or localities. Like, for example, JKN, the social insurance. It's really capped on which health clinics you are in, you know, jurisdiction of. So yes, I think address is one of the still remaining problems to be solved, and especially when also including if you are in government's owned land. And this is a lot of problems with masyarakat adat, with traditional communities, and those were very mobile. Yeah, you cannot get an identification in a, you know, like in a straight line, like we see 3-in-1, or then you can get documents, but there's a lot of complications you have to deal with.
Yeah, just extraordinary. Do you have any kind of solution, Santi? What do you think should start happening?
Well, solutions, I think I'm a big believer, otherwise I won't be here, of we need to start from somewhere. It might not be perfect because nothing is. And I think I can just go back quickly to this, that it's really important to first, the advocacy efforts still need to continue, and this is to remove the policies that are you know, blocking people from accessing documentation and services. And it's probably not, you know, it's probably not the 90% of the population, so it's not that massive in terms of number, but it is what inclusive development is all about. It's when you are thinking more about those who are, you know, falling through the cracks instead of those, you know, in the majority who has been sort of thriving. The second is that any registration must start from villages, because the civil registration offices are mostly at the district level, and it's just really, really impossible for some of us to be able to access them easily. The second is, of course, then you need to fix the technical issues and really address those who on Susanas, before we saw have registered their child but have not received the documentation. So what happened? And then let's just stop doing awareness campaign, because it's not that people don't aware that it's important, but it's about helping them, facilitating the process in basically accessing those services. And don't stop at birth. When you talk about birth, it means you're talking about marriage, divorce, migration, and also at the end, death registration as well. It's a big homework in Indonesia. And really about starting to think that it's more than getting someone a piece of paper, but it's about population data. And population data should be basing all of the government services and should be managed and protected throughout our life cycle, with the sole purpose of providing us the right services, not to police those who are not entitled to get something. So that would be my sort of longer response to that question, Sharon.
That's great. That's great. And I can see another question, Anita. Do you want to take this?
Yeah, we do have Mbak Sophie thanking Mbak Santi for addressing the newest news on transgender access to ID card. So, but we also have a question from Bu Siti for Adila. What an interesting issue. Have you and team do research or any learning about the birth certificate issue for children who are born in prison during their mother justice process? Because Bu Siti learned from the experience that children's basic rights are overlooked in that situation, especially when they must follow their mother to live in correctional center or prison.
Yeah, thank you, Bu Siti. So in Indonesia, a child until 3 years old can stay with their mothers who are undergoing their sentence in a prison. And we just, actually Puskapa just finalized, Bu Siti, a recent research around the implementation of juvenile justice law. But unfortunately, we did not find such case, so we did not explore it further. But Sheila, do you have any other insights on this issue?
For children living with their mother in prison, we didn't really study it, Mbak Santi, but we saw some connection between the justice system and the civil registration right now for children coming into justice system. So I think there are optimistic progress so far on the connection between system, and I hope it will happen as well in children living with their mothers in prison.
Yeah, lovely. And do you think COVID is going to have much of an impact, you know, just thinking here in Melbourne of all the times you have to scan and that kind of heightened surveillance and regulation and all of that, will that help or hinder the registration process in Indonesia in any way?
I'm hoping at least on both. So it's balanced a little bit. But for example, the latest battle, if you may call it that, was when the government decided to require an NIK, the unique identification number, before someone can access vaccination for COVID. And we fought tooth and nail just to really asking them to reconsider, because even though it's sort of seen as an opportunity to actually, you know, register everyone who must be willing to come to the vaccination post and, you know, admit that they did not have an NIK, it's just so unlikely in theory, because these people are really already the most marginalized. But I don't know, I think it's still ongoing, the battle, but I suspect we're not going to win this one. But what we are planning to do is to, if and when it happens, really to provide assistance to local governments who probably need to set up, you know, like a special post in the vaccination areas, so people without an NIK can also get vaccinated, but at the same time being sort of recorded and get their NIK processes down the line.
And is there any impact for funerals, like at the other end of the life cycle, if you're not registered in any way?
Yeah, so that was what I was gonna say next, was that, you know, if you think about it, then death registration should be front and center in the policy discussion now, because I think at the moment, and I'm still trying to just wrap my head around it, it's really almost impossible to calculate for death in Indonesia. And it's because, you know, like death registration is really, really, really low. And those who, in our surveys, who had access to death registrations are those who basically are military, ex-military and ex-civil servants, so they can access the pension funds. And it's like really just a fraction of our population. Secondly, it's those who whose families died in health facilities, and that then even, you know, like also a fraction. And if we are counting on funeral data or burial data, it's also unreliable, because I think our last survey showed that only about 30% of people buried their families in the, you know, in a public burial sites. So most of them in the villages really buried their relatives in the yard, and, you know, in front of their house or in the back of their house. So it's just really, really problematic. And I think the biggest homework now is death registration and at birth registration. I hope that was useful.
That was great. That was really very, very interesting. And we really hope to welcome you one day to Monash, and you can welcome us all there when, again, we can travel. So it's been lovely that you could join us, and Shayla, you too, and a big shout out to Rennie and Anita, and especially Lauren for putting all the back end stuff of it together. And thank you all of you for coming. Our next seminar will have, we are having Emma Belt, who will be speaking about popular music, technologies and class in Indonesia, and she's based in Malaysia, so that will also be really interesting. So thank you again, Mbak Santi. Thank you to everybody. We'll see you next time.